Podcasting from the base of Lake Tahoe in the eastern Sierras comes the Medicine Wheel. We are a group of progressive physicians seeking solutions and enlightenment while surfing the seas of big data and summiting mountains of research in an effort to make the practice of medicine more personal and medical knowledge more accessible. Our open-minded approach and inquisitive nature will hopefully shed light on new and novel concepts in medicine and empower you, the listener, to be as healthy as possible. We welcome you to sit back and join us around the wheel as we review recent news in medicine and science, explore interesting topics, discuss human interest stories, interview physicians, scientists, philosophers, shamans, and other wise folks in order to satisfy our curious appetites. Now, the Medicine Wheel.
Welcome again to the Medicine Wheel. Today we're blessed to have both myself and Dr. Floyd here today, along with a colleague of ours and someone who sort of predates us from the university, Dr. Vance Alm. Thank you so much for joining us here today, Vance.
Pleasure to accompany you.
Awesome. Great. So I know that you recently wrote a book, but I also have some preliminary questions I want to ask of you before we dive into the very short novel you wrote this past year. Tell me a little bit about how you ended up in the field of medicine. You're like a lot of us and took a unique path to become a physician, and you had almost a prior life before that. Can you talk a little bit about what that was for you?
So I'm one of those people that's going to be the future. You don't just have one profession, you're going to have a series. Anyway, I always wanted to be a doctor because when I was 5 years old, I watched the guys sew my hand together. That's what I wanted to do. So through my life, early on, I wanted to be a doctor, and so I went through in high school and everything, and I studied all the right things. And then that wonderful twist, I went into the military because I couldn't afford to go to school. And so after a career in the military, then I went to medical school. So a little bit diverse background from the average person going into medical school.
Now, tell me a little bit about your career in the military, because it was an extensive one. It wasn't just like I did a few years and then came out.
First, when I went in as an enlisted man so I could get money for college. And then after attending college, paid for through the military, I decided that I wanted to go into medicine. And unfortunately, I didn't get accepted first, and so I still had to take care of a family and myself, and so I went back into the military as an Air Force flyer. And so I was a navigator on KC-135s, and so I had to experience traveling around the world and seeing different sites, but also I had to experience military medicine. Military medicine is different because you don't pay anything, and I think that that's a model that we may have to pursue.
Great. And I'll move on to this next one. I know Dr. Floyd's sort of chomping at the bit. He has a question for you. What is the most profound lesson that you've learned in your practice? And how many years have you been practicing now? Close to 20, right?
So graduated from residency 18 years ago, and so I've been happy and have experienced my own practice with a partner, experienced my own practice, and then I worked for a corporation. Didn't like it, so now I'm back to private medicine all by myself. Biggest lesson I think I've learned is to treat people as people, not just as a case or a disease.
Yeah, that's excellent.
That's a good way to put it, because we're patients are more than just numbers on the paper and a chart number as well.
One of the things that I've practiced forever is the philosophy of treat other people the way that you would want to be treated. It goes far, especially if you apply it into medicine as well.
Yeah, that's true. Kind of give us a flavor of what you do outside the clinic. I know you kind of have a little Marcus Welby practice here in town, but what do you have a passion for outside of medicine? I know there's a variety of things. There's two I'd like you to talk about. Number one is the Scottish Games, and number two is your love of travel.
And so my love of travel has expanded greatly because I finally have the means to do it. So as a father, I didn't have that opportunity to travel, although I traveled widely with the military. So I've seen lots of countries around the world and seen a lot of different things. But now I'm getting that age where, how much longer do I have on this planet? So I've decided to just enjoy life. And so I've had the opportunity to go to Europe a couple years ago, and now I'm traveling around and enjoying life. And I missed the first question.
Oh, the Scottish Games.
The Scottish Games. Again, my son, he kind of pointed me in that direction by saying it's something that I should at least observe. And they happen to have a game here in Reno, and I decided to try. And so, being a rather large guy, I thought, well, I'll do okay. And so, for my very first one, I got first place. So I thought, if I can do that, I may have to stick with it.
That's awesome.
Yeah. So I know there's a lot of photos of you in your office doing a whole wide variety of things. There's another thing that I don't know if you're closeted about or not, or you're open to talking about. It's not like you know anything strange, but you like to dress up.
Yes. So one of the things in life that I tell my patients is to enjoy life, to live life to the fullest, to not just be an innocent bystander, but enjoy and partake. And one of those things involves different costumes. And so I enjoy the Renaissance Festival. It's interesting, it's unique, it's something that's quite fun. I enjoy dressing up for a steampunk. Again, it's interesting, it's fun. I've been a participant in Civil War reenactments. Again, my love of history has drawn me to that. I've also been a person who dresses up for World War II enactments. And it's one of my passions because World War II D-Day, we'll have the 75th anniversary here this year, is one of the most important things that ever happened for the United States. We established and maintained democracy for the world. We vanquished the fascists, and free-loving people get to enjoy that.
Wonderful. The other curious thing that people may not know about you, because I know it's been a few years since you've been, is that you actually went and worked at the Burning Man Festival.
Yes.
Yeah. Talk to me a little bit about your experiences out there.
And so I went to Burning Man for 9 years. And it started in residency because the person that was instructing me was going to be out at Burning Man providing health care out there. I asked if I could come along and see if I would learn anything. From that, I learned a great deal. One of the biggest things is that everybody needs to have health care at some point. One of the most enjoyable things, though, was that at Burning Man, you actually get to live and breathe and talk with fellow free thinkers. Instead of just the regimen of it has to be this way, it has to be that way, people were encouraged to think freely, as evidenced by the art. All sorts of different things were encouraged as art. Some of them don't appeal to every single person. One of the bad things is that Burning Man changed over the years. It used to be very small, and it was a special group of people coming together, and it was that hippie group that was coming together. Peace, love, and all those wonderful things that we enjoy. It's gotten a little bit tainted now. I think there's a little bit too commercialism. I think that it's gone away from its root, but it still embraces the thought of free thinking. We as humans need to remember that. Think for ourselves. Look at the lessons that are around you, but think for yourselves.
Yeah, I was reading Stealing Fire, and they talk about Burning Man a lot and about the Silicon Valley bigwigs. A lot of them go out there and they either prove their worth and they come up with different ideas, and it goes right along with your lines of free thinking. And I think it encourages people to open their minds and kind of think outside the box. Unfortunately, I've never been there. I'm thinking hopefully next year, if Sean will take me.
All right, he'll be my date.
And so one of the things to remember is don't buy into some of the hypocrisy that people will say, that you have to dress as a liberal, crazy person. Go as you. Be yourself. Just enjoy the time that's out there. Enjoy everything that's available. It's not just one mindset that is supposed to rule. It's think truly free. Enjoy and do whatever you want to.
Yeah, there's a bunch of tenets that were outlaid around Burning Man, and they still hold true. And Larry Harvey, unfortunately, who passed last year, made some big contributions in complete ownership in an authentic way that is about interconnection. It's about creativity and expression. My experiences there have been diverse and profound over the past 20 years. But what you bring to my mind is that how eclectic and how different every individual is when they go out there. And you're right, they can shed the mask that they wear in traditional society and be who they are. And you and I know that we have had peers and colleagues and folks who even taught us that express themselves in a very beautiful and unique way there that we would never have seen if we stayed within, I guess, polite society settings.
Yes. It's just a place where you can enjoy being whatever you want to be. And some people think very far outside the box. And some people think very narrowly, this is how I have to be. Do what you want. Enjoy. Be the person that you want to be, not what society, even the Burning Man society tells you have to be. If you want to dress up as a knight in shining armor, do it. If you want to be the most liberal person and walk around with nothing on, that's your choice. Do whatever you want to be. It's what we should embrace further for our general society, but we fairly often stick to the norms. We think the way people tell us we have to think. Be free. Think for yourself.
Yeah, that's good advice.
That let's change this and go to medicine. And you were telling me earlier about your 4 hypotheses to happiness, and that you tell all of your patients. And can you go over those again? They're very interesting.
So some simple things that you can look at, and think of these as ways of defeating anxiety or depression. Number 1, live your life. Far too often we're trapped in a role and we don't actually live life. Life is to be lived. You work to live. You don't live to work. So live and enjoy life. If you're doing things that you enjoy, life will be better. You won't be depressed. You won't be anxious. Number 2 that can help that, exercise. We build up all the apprehension and certain chemicals, adrenaline, when we just sit and we worry about everything that we have to either run away from or fight against. Release those chemicals. Go for a walk. Do something that's fun and enjoyable. Exercise. If you do something that's aerobic, it tends to have a rhythm to it. When you get into your rhythm, it will create a calming effect. 3rd on the list, you need to talk to people. We far too often are just typing things down. We're not talking to people. The social media is great, but you need to talk to people and bounce ideas off of. If you're frustrated with something, if you have a problem and you tell it to somebody, they now have your problem as well. They share your problem, and you're now burdened with only half of that problem. And usually they're going to try and comfort you and say something like, Vance, it's going to be okay. But they're also going to give you a suggestion. It may be the worst suggestion that you've ever heard, but often it makes your brain start to think of the possibilities of, there are solutions to my problem. And then number 4, what are your goals? That's actually a problem I see with the whole country. We don't have goals. We're just meandering through life. Without goals, without a focus to your life, you're just going to meander and you're going to worry about the inconsequential things instead of worrying about what's really, truly important to you. Best place for finding out your goals, think back to when you were 12 years old. What did you want? Oftentimes that's going to tell you where you should be headed. But don't just think about the goals. I want to be rich. It doesn't work. You need to have something that's really much more fundamental, something that you can actually hold on to. And in addition to the goal, what is your plan for life? Without the plan, the goal just remains out there. So come up with the plan. Come up with a goal. What do you want to be? I wanted to be a doctor. I waited until I was 37 years old to attain that goal. But I came up with a plan. I worked it and worked it and worked it until it finally would happen, and I made it happen.
Awesome. That's great.
That's a lot of wisdom. I think that you kind of help us segue into part of the conversation where we sort of discuss a little bit about your book, because you wrote this book, I think, in a response to some frustration you felt about how healthcare in general was going. But the other component is, and a lot of people may not know this, you ran for Congress, I believe, 3 separate times. Is this true that you ran?
It's true.
Okay,
I'm a failed politician.
Okay, well, there's worse things than that. So tell me a little bit about how you came to the conclusion that you needed to write a book, and also why you thought it was important for you to run for Congress. What changes were you hoping to make?
The changes that I wanted. I ran 3 different campaigns, and in each of those campaigns I felt there's 3 main things that every person in America needs. Good health, a job, and the education to attain that job. What are the issues that we talk about all the time in politics? Anything except for those 3 primary things that will affect every single person. And so there was an opportunity that a previous senator said that there wasn't going to be a congressional candidate, so I decided I will step up and fill that void. And so that got me interested in politics. And again, I came up with those 3 things that I felt were important because of my grandchildren, because they have a future that looks quite bleak to me. And so I felt that I needed to address those. And so I looked and began to get more and more frustrated with what I was seeing in regards to the ideas that were out there. Strangely, being a staunch Democrat, I'm not a big fan of the Affordable Care Act, because being a physician, I've seen where it didn't seem to work. And so if that doesn't work, what does work? And rather than reinvent the wheel, I looked at different countries and see what they have to offer. The system that seems to work the best is that we need to have a system not of government-involved health insurance. We need to have government-provided health care. And so that's what my premise in my book is. I think that we need to look at how to provide health care and address all of the problems, not just who's going to pay for health care. One of the things in my travels was that I asked people, well, what do you think of your health care? In that, when I was in Europe, every single person I talked to felt that their country was providing the best health care that they could possibly have. And yet I asked my own patients what they thought of health care. Is health care in America broken? The answer is yes. 100% of the people that I asked said that health care in America is broken. And if you look at the statistics, it definitely is. We pay too much and we get far too little for the money that we spend. We're suffering, and yet we don't know how to change it. And I decided very quickly that I was going to run again and again until people started to understand that healthcare is a big issue. And it went from 3 campaigns ago to a non-issue. 2 campaigns ago, it began to be an issue. And this last campaign, it was the #1 issue in America. We have to make some changes in healthcare. And being a doctor, I think that it's my role to be a patient advocate and that I have to make changes in healthcare.
Yeah. In your book, you refer to as this new solution potentially being referred to as Fed Med. The concept would be that you would have the government pay for and provide medical care as part of not only a safety net, but basically almost like a right for patients. Talk to me a little bit about that concept, and where do you think it's best represented in the world today, your model?
So FedMed, a short term for federal medicine, federal medical system. It's the concept where instead of having the government provide insurance, the government is actually going to provide health care. We already do it in this country. We have military medicine, we have the VA, and we have Indian Health Service. In each case, you're actually providing health care, not a promise to get health care. I think it's important that we look at this because right now we're on a road for the medical industry to bankrupt America. We have to do something now, and this is probably the best choice. We have public education and we have private schools. Why not public health care and private hospitals? We can do this, and it's just a matter of how do we commit to it. The best example in the world is the UK. They have an awesome system. And when I was in England, I asked a young gentleman, what did he think about his healthcare system? And his response is, it was effing great, man. And so no person that I've talked to in the United States has ever said that we have a great health system. So this is an option that we should look at. Instead of just thinking about who's going to pay for health care, we need to have the federal government step in and say, hey, we're already paying for a socialized medicine system. Why don't we set up something that's actually going to work for the people? And we worry about all the millions of people that don't have health care. Well, if you have a federal system, everybody's grandfathered in. Well, who's going to pay for it? We're already paying for it in the form of Medicaid and Medicare. Just take those monies and put them into a federal system, and also have the private system running alongside for the people that don't think that that's going to provide a good enough health service for them. I think we could do much better with a public health system that doesn't worry about profit, that doesn't worry about do you make enough money to have good insurance, that doesn't worry about, well, I have to do the procedures that are going to make the most money for me, that don't worry about getting a patient in month after month to make sure that the doctor is getting more and more money. We need to look at what's going to worry about and actually secure the art of medicine for physicians, so that we look at the health of our patient instead of the money that's going to be generated by the visit. We need to have doctors paid with a salary instead of working for a piecework. Well, how many hours, how many patients, how many whatever did you see? It'll just be, is the health of your patient better? Yes, that's what we as physicians try to look for at all times. We try to take care of our patients, and yet insurance now is interfering with that. Insurance makes so that, well, I can't give you the best medicine. I have to give you this medicine because they think it's appropriate. Well, I can't get you that radiology procedure because they won't allow it. I can't get you that surgical procedure because they won't allow it. It's time for the federal government to step in and say, we want to worry about the health of our people, our citizens, not the cost of what that health care provides. And instead of funneling it through for-profit, we need to set up a government-run system.
You bring up a few points, and unfortunately America is, we were talking earlier before the show, as sick as it's ever been, physically, mentally, and we're having difficulty accessing health care. And why do you think that the system is so broken? What are a couple of contributing factors, and why do you think that as a community we're so sick with increased chronic illness and such?
Well, a big part of the problem is that we worry about everything. Our psychiatric health is really in a poor situation because society has to worry about, if nothing else, the cost of their health care. If we got rid of that one thing, we might be like Denmark, the happiest country in the world. If we didn't have to worry about our health care, am I going to have a job? Do I have the money to get a good education? Do I have a place to stay? If we got rid of some of those cares, we would be healthier psychologically, and we would just be better physically. So part of the problem is that we've emphasized over and over in our country specialty care. Over and over, instead of focusing on health, we focused on the disease process. Well, there you have cancer. Well, they have a knee that needs to be replaced. Well, they have this and this and this. Instead of looking at the whole person, we focus on just one area. We need to get back to generalists. Canada did well when they converted because they are primarily primary care. They looked at the whole person instead of just the one aspect. That is what we need to return to. But we also have a problem in that we allowed the hospitals to become more and more important. Instead of just worrying about the physician and the patient, we need to start thinking about how can we curtail some of the excesses that are out there. All of the excesses are profit-driven. We in this country are too focused on business instead of focusing on moral issues, ethical issues, how to treat our fellow being, how to treat everyone as an equal partner in this great endeavor called the United States. We need to look at how can we make it better for everybody instead of how do we make it better for the richest of the population. We need to focus on actually providing good health care, and part of that will be preventive medicine. We've gotten away from preventive medicine because it doesn't pay. The focus of the health industry complex, just like the military industrial complex, is that it focuses on more and more profit. We need to get away from that and again go back to the focus of the art of medicine to improve the health of every patient.
You bring up a really good point. The fact that the healthcare industry is that it's a business, and it's in general it's for profit. At least those who are holding sort of higher administrative positions, it can be very profitable, even though it may be under a nonprofit moniker. My concern comes from the fact that we have moved so far away from that intimate relationship that takes place between a patient and a physician, and almost like a healing relationship, that's been sort of severed here, at least in the United States, by these third-party administrators, whether they be, like you said, hospitals, insurance companies, lawyers. Kind of tell me how your premise of having a FedMed may help overcome some of these issues, because I see a few problems with FedMed, one being a caste system almost developed. So those people who couldn't afford it, they go to FedMed. Do they get VA-style care? And then those people that can't afford it, they get more elite care. or higher level care. Talk to me about how you foresee this eventually coming together if you had your way.
So one of the things that if we did actually pay our physicians a salary, instead of worrying about their piecework that they would get, they would do a better job because they would be able to spend the amount of time that they needed. Instead of, I need to rush through 20 patients in a day, they could say, I see each patient for an hour each day, that they need the health care. They don't come in for wasteful situations. They come in when they need it. One of the problems with the industry is that we have, as you were saying, not-for-profits that are being paid as if they're a for-profit. A CEO of one of the hospitals in town, not-for-profit, his salary as the CEO is $1.3 million. I think that's a little excessive. All of the people that are involved with the administration of healthcare, all the people that are checking for your insurance, all the people that are checking to see that you're going to the right person, all the bean counters that are looking at, well, do you have the right diagnosis code and did you bill for the correct procedure, that accounts for roughly 24% of the cost of medicine in America. If we were to get rid of that and the supposed 5% of profit, you've saved 30% off of the cost of healthcare. If we continued to put the amount of money that we currently spend on healthcare by the federal government into a healthcare system, we would have more than enough money to take care of it. If you wanted to address a problem with, well, who's going to pay for the drugs? If you got rid of one aspect of what the pharmaceutical industry spends on healthcare, they spend up to 36% of their budget on marketing. Get rid of that 36%. And you now have medicines that cost far less than what they currently cost. If you negotiated prices that are adequate for the pharmaceutical industry with a federal medical system, like the VA does, the cost of those pharmaceuticals are going to go way down. The things that are not addressed by most of healthcare today, though, are things that a federal system could. Preventive healthcare. It's not profitable, so we don't spend money on it. The healthcare insurance companies, they don't want to spend money on that because that's going to be a benefit that another insurance company will get the benefit that, oh, their patients, after they've switched insurance 3 or 4 times, they're going to be the beneficiary, not my insurance company, so I'm not going to spend for it. We worry about the opiate crisis, another example, and yet nowhere does the current political talk discuss how to really fix that. If you had one system that tracked where everybody was getting their pharmaceuticals from, you'd have it cured. But then there's the illegal source. And yet, if you are an addict and you want to get your health care, you need to get it now when you made the decision to come off of opiates. It doesn't exist because current system, we don't have a large enough share of mental health care available. A federal system, again, could build on this. One of the interesting things is that people worry about the money and they don't look at what the ultimate results are going to be. And so with healthcare in America, mental health care is no longer profitable, so we've withdrawn from it. Rural health care is no longer profitable, so we've withdrawn from it. Access is not just having the money to go to get that health care, it's also facilities. We also don't have enough physicians in healthcare right now. The reason is because healthcare education is over the top expensive. I just finished paying off some of my school loans 20 years after I took out those loans. And those loans accounted to about the cost of a house. So that is no longer affordable. People don't make their own office because they can't. They can't afford to come out with a debt and then go to work for themselves and assume that for a year or two they're going to make very little money. They have to join into corporate medicine. We need to get away from that model. If you had a federal system that decided to, well, I will pay for your medical school as long as you come and work for me, kind of like the military does with pilots, we would have more people getting into healthcare. One of the reasons I really address that is because, according to the World Health Organization, the United States does not have enough physicians for all of the people in the country. And we seem to be chasing them away from providing primary care into the specialties because that's where the money is. We need to take both of those things away. We need to have a system that's actually going to provide health care, not health care insurance. that piece of paper is pretty worthless. How many patients do you have that are on Medicaid? Probably don't.
Well,
Because they
personally,
can't-
for sure.
Because they can't afford to come and see you.
Yeah.
I have several Medicaid patients. The problem is they've got this wonderful piece of paper that they then can't go to the right specialist to get care. If you want to send a person on Medicaid to a dermatologist, you have to look outside of the city of Reno Sparks.
Yep.
If you want to send them to an orthopedist, it's going to be hard and challenging. Neurology, neurosurgery, countless specialties don't take Medicaid because it doesn't pay enough. Well, with the federal system, all those people are going to get adequate care. We're going to have a leveling of the playing field so that everybody's health care is going to be very similar. It's not going to be based on a class system. It's going to be based on everyone has access. And you know what? When more than 60% of the people are getting their health care from the federal government, they're going to demand their politicians actually provide adequate care. One of the problems that the UK has and why they have a problem is it continually is underfunded. The conservative government there is trying to make so that it'll become, we want a commercial system. Well, commercial systems don't work. We've talked about it already. You don't live as long in the United States compared to countries that have embraced a government system, and you have more infant deaths than countries that have embraced a government-run system. It's time for us to make a change. It's time for us to do the sensible thing.
All right. Well, it almost sounds like you're back on the campaign trail, Vance, but that's cool. I know we see some things eye to eye, and other places we have some differences. We're getting kind of to the end of our time slot here, but I wanted to ask you just if you could sort of put yourself out into the future. What do you think medicine in general is going to look like in the next, say, 25 to 50 years?
Medicine is going to end up being much more class-driven, because as the prices are increasing and the share of the U.S. economy that is spent on healthcare goes up and up, less and less people are going to be actually involved in getting healthcare. There's going to be more turning to, well, what can I get over the counter? There's going to be more illegal. There's going to be more setups where someone who is not really qualified to provide your healthcare is going to be providing your healthcare. People are going to be looking to the internet to find the answers that they can't get from going to a doctor. It's time for us to be patient advocates. We need to step up. We need to make an effort and make sure that politicians start listening to the medical community instead of just going along. We've been silent for far too long. It's time for us to be involved. It's time for us to stand up and yell at our legislators and say, this is what needs to change. And don't go with just whatever is out there. If I'm not right, then come up with a solution. Instead of just pointing the finger and saying, that doesn't work, come up with your own solution. Write books, write articles, talk to people, talk to everybody you know about how should we have it. Place yourself in the future, look at the facts that are there, and then extrapolate them out. Would this work? And find out if it will. Talk to people and find out what are the solutions instead of just pointing the finger at the bad things that are going on.
Great. Vance, could you do us a real big favor? Could you show us your book? I know that you have one tucked in there. I think for the viewers and listeners who have an interest in learning more about what Vance is doing, this would be a great resource for you. And the title of it, The Doctor's Prescription for?
The Doctor's Prescription for What's Ailing America. And right now it's how do you get access to health care? This is just one description of one plan. I hope that there's talk of 100 different plans on how to fix this, but we need to start talking and we need to make some effort to make some changes. If I'm wrong, I would be happy to admit it, but come up with a realistic plan instead of just promising a plan and then presenting no plan. It's time for us to actually do something about healthcare in America.
Great. Vance, thank you. Floyd, do you have any questions before we wrap up?
No, I think it's great. Thank you for your time.
Yeah. Listen, once again, I want to thank to all of our listeners and viewers who check in with us here at the Medicine Wheel. And again, it's been a blessing to have you on, Dr. Vance Alm. You've been a mentor of mine for years, and it's a pleasure that you've been willing to give some of the time today to us.
It's been my pleasure, and again, think outside the box.
Hey, thank you for that.
Go out and be healthy.
All right. Blessings, everyone.
The Medicine Wheel encourages all of our listeners to subscribe to our newsletter and podcasts as we continue to explore the world of medicine, bringing you up-to-date health and science information. The Medicine Wheel invites our listeners to email us any newsworthy stories or topics they wish to explore further and discuss on the podcast. For more information about the Medicine Wheel, please visit us at our website, www.themedicinewheel.org, and on Facebook at The Medicine Wheel Podcast, and finally on Twitter and Instagram at The Med Wheel.
In an effort to support access to integrative medicine and functional medicine options for those in need and education for those who need information, please consider donating to Project OMCare, 501c3.org. Please go to our website, www.themedicinewheel.org, to learn more.
Thank you again to all our local sponsors, Grateful Gardens, Lighthouse Coffee, and Dorinda's Chocolates, which represent some of the best organic and appetizing options in the Reno, Tahoe area.
Lighthouse Coffee Shop is a proud sponsor of the Medicine Wheel. We are a family-owned and operated local coffee shop. Our goal as a business and a family is to cultivate community wherever we are. All of our coffee is ethically sourced, organic, and farm fresh. It's roasted in-house daily, guaranteeing you access to the freshest cup of coffee on the planet. We care deeply for our community and everyone in it. We strive to provide you with the best ingredients and most comfortable environment. Come and enjoy coffee with us. We are family, and we would love for you to be part of it.
Gerber Medical Clinic is proud to support the Medicine Wheel and medical education to improve health quality, nurturing the lifestyles of our listening community, enhancing wellness for all. Thanks again to Wired Insights and their talented team for making our podcasting dream possible.
In closing, we would like to remind all of our listeners, if you have a medical concern or diagnosis, you need to see your personal doctor without delay, and if needed, obtain a referral to a specialist. If ever you feel the health issue you have is urgent or an emergency, please call 911 and go to your nearest emergency room. Please do not take any of our physicians' commentary or our guests' opinion as medical advice, and always seek out medical care from fully licensed and appropriately trained medical professionals in your area. The information shared in this podcast is for general information only and should not be construed as medical advice, and understand that no doctor-patient relationship is formed. The use of this information and educational materials linked to this podcast and website are employed at the user's own risk. The content of this podcast is not meant to be used as a substitute for medical advice, diagnosis, or treatment.
This is the Medicine Wheel signing off for this week with a reminder to live, love, listen, and learn.